Welcome to Anatomy Visions. Today, we explore a deeply fascinating medical phenomenon where intense emotional pain literally breaks the human heart. Can you actually die from a broken heart? Science says yes, and the exact medical term for this is Takotsubo Cardiomyopathy. The word Takotsubo comes from Japan, translating directly to octopus trap, which perfectly describes the bizarre shape of the affected heart. Let us look closer at the true anatomy of the human heart to fully understand how this incredible and dangerous syndrome operates. The heart consists of four main chambers. These include the right atrium, the left atrium, the right ventricle, and the left ventricle. Normally, oxygenated blood flows smoothly from the left ventricle into the aorta, pumping life-giving energy throughout your entire physical body system. The left ventricle is the most powerful pumping chamber, responsible for pushing the rich blood out to every single organ and tissue. However, under extreme psychological distress, this perfectly synchronized pumping mechanism can suddenly fail, leading to severe and life-threatening medical complications immediately. Severe emotional trauma, such as losing a loved one or experiencing a devastating breakup, triggers a massive and overwhelming physical stress response. This sudden emotional shock causes the brain to release a massive surge of stress hormones directly into the human bloodstream quickly. These powerful stress hormones are known as catecholamines, with adrenaline being the most prominent chemical flooding the entire cardiovascular system almost instantly. While adrenaline normally helps us fight or flee, an extreme overdose literally stuns the delicate muscle tissues of the left ventricle chamber. As the muscle becomes paralyzed by the hormones, the apex, or the bottom part of the left ventricle, balloons outward very dramatically. This sudden ballooning effect creates a shape that looks exactly like the traditional Japanese octopus trap, giving the condition its unique name. Because the bottom of the ventricle is paralyzed and swollen, the heart can no longer contract effectively to pump blood properly anymore. Patients with this syndrome often feel severe chest pain and shortness of breath, perfectly mimicking the symptoms of a massive heart attack. Doctors in the emergency room initially treat these patients as if they are having a standard heart attack due to blocked arteries. However, when medical professionals perform an angiogram to check the coronary arteries, they surprisingly find absolutely no blockages in the blood vessels. Instead of blocked pipes, the primary issue lies entirely within the muscular wall of the heart itself, temporarily stunned by emotional grief. This profound mind and body connection proves that our physical organs are incredibly sensitive to the emotional pain we experience in life. You might wonder who is most at risk for developing this terrifying condition after experiencing a sudden and heartbreaking emotional life event. Medical statistics clearly show that women are significantly more susceptible to developing Takotsubo Cardiomyopathy compared to their male counterparts in the population. In fact, post-menopausal women represent the vast majority of recorded cases, highlighting a potential link between changing hormone levels and heart vulnerability. The exact reason why older women are disproportionately affected remains a subject of intense ongoing medical research and deep scientific investigation today. Some researchers believe that the natural drop in estrogen levels after menopause leaves the female heart less protected against sudden stress hormones. Despite the terrifying symptoms and the real danger of heart failure, there is actually a very positive silver lining to this condition. Unlike a traditional heart attack, which causes permanent and irreversible damage to the heart muscle cells, Takotsubo cardiomyopathy is usually completely reversible. With proper medical care, rest, and time, the stunned heart muscle can fully recover its normal shape and pumping function without scars. Physicians typically prescribe specific medications, such as beta blockers, to help shield the recovering heart from any further surges of stress hormones. These medications reduce the workload on the heart, allowing the paralyzed left ventricle to slowly regain its strength over several quiet weeks. Most patients who suffer from this broken heart syndrome will experience a complete and total recovery within just 1 or 2 months. This remarkable healing process showcases the incredible resilience of the human body, even after enduring the most devastating emotional shocks imaginable today. It is crucial to remember that emotional health is just as important as physical health when it comes to protecting your heart. Finding healthy ways to process grief, manage daily stress, and seek psychological support can literally save your heart from this dangerous stunning. Medical professionals now recognize the profound impact of psychological trauma, bridging the historical gap between mental health care and traditional cardiovascular medicine. If you or someone you love experiences sudden chest pain after a tragic event, never ignore it and seek immediate medical attention. Early diagnosis is absolutely vital to ensure the patient receives the correct supportive care while their broken heart begins the healing process. As we continue to study this fascinating syndrome, we uncover more secrets about the delicate balance between our fragile minds and bodies. The Japanese octopus trap remains a powerful and poetic metaphor for how our hearts can become temporarily ensnared by overwhelming emotional sorrow. Science continues to prove that ancient poets and writers were entirely correct when they described the physical agony of a broken heart. Our cardiovascular system is not just a simple mechanical pump, but a dynamic organ that deeply feels and reacts to our emotions. Understanding Takotsubo Cardiomyopathy helps us appreciate the beautiful complexity of human anatomy and the profound power of our emotional and mental states. We hope this deep dive into the broken heart syndrome has enlightened you about the incredible connections within your own physical body. Always remember to take good care of your mental well-being, because your physical heart is always listening to your emotional pain. Thank you for watching Anatomy Visions today. Please stay curious, take care of your heart, and we will see you next time.